You're watching CTOM TV. Knowledge is power.
So now I want to share with you some of my favorite sources for information since this whole thing began. And what I'm going to do right now is I'm just going to stop sharing this particular page, and I'm going to go to these sites right now to share with you what we've got. Let's see here. Okay, so this is an excellent site. Let me refresh. This is a site that was created by Johns Hopkins in the United States, a well-reputed hospital at Cancer Treatment Options and Management. We've shared patients with Johns Hopkins and have always found them really excellent to work with. And what they did when this whole thing began is they created this coronavirus resource center, as you'll see on my screen here. If you look in the red, you'll see that as of today's date, Friday, the 27th of March, about 3 o'clock in the afternoon, Pacific Standard Time, we have 590,594 total confirmed cases of COVID. Of those, if we look on the far right, we see in green, total recovered 130,865. And right now, reported deaths from COVID around the world, 26,943. Which I did the math before we started today, amounts to about 4%. 4% of total confirmed cases have died, which is about what we were told to expect when this whole thing began, anywhere from about 4 to 6%. So we're pretty much on cue. As you can see here, it's listed by country. So let's go to the US here. The US has surpassed everybody with cases right now, having over 100,000 cases. You can click there, and as you see, now the total deaths and total recovered is very specific to the US. You can scroll through and you can find your region and see what's going on there if you want to. You can also have a look, which I think is kind of reassuring, at places that first dealt with this, such as China, such as Italy, South Korea. Where are you, South Korea? These were the places where this outbreak really hit hard at first. And you can have a look at how different of these countries are now succeeding in keeping the numbers down, particularly China and South Korea. And South Korea is actually really a great success story, and for one very obvious reason that I think is just important for you to keep in mind, because I think it can instill a lot of hope for the future for us. And right now it can be hard to feel hopeful. South Korea has had really the best response of any country thus far in terms of keeping that curve that we talk about flat. You can see, well, actually it's looking like it's high there, but in contrast to other countries and based on their population, they're actually doing fairly well. The reason for that, which I think is really interesting, is that in 2005, South Korea experienced a SARS outbreak. It hit them hard. Lots of people were killed. It was not a pleasant time. But in response to that, South Korea got really smart, and they've built up a massive pandemic response. They had protocols put in place to help to ensure that if anything like that happened again, that they would be quick to respond. And something like that did actually happen again. They had a MERS outbreak in 2015. Pretty sure it's 2015. And they still realized at that point that they needed to do some tightening up. It started to get a bit away on them, but not as much as it would have because of the things they had done before. And so when this pandemic came around, they were ready. They'd already had 2 nationwide outbreaks. They had a wonderful response team set up. All of their testing, they had lots of tests, and their testing systems were really well established, great sterile technique, and so the spread of the disease was really mitigated as a result. And why I'm sharing that with you is because I think, if we don't understand that it's possible for governments to learn from this, get ahead of it, and help to prevent it from having such a massive impact in the future, we can start to feel a little bit afraid about what the future is to bring, as more and more viruses that we don't have immediate vaccines for are shared around the world or originate. So I like to look at South Korea as an excellent example of what can happen when countries learn from past experience. So now I want to share with you the Canadian website. All these links are going to be in that PDF that you can have access to, so it'll be really easy for you to keep an eye on these for yourself. The Canadian website, this is where you'll see a listing of all sorts of information about COVID and hospitals and what it's all about. But mostly what I want you to see here, if you're interested, is the number of confirmed cases by province. A number of probable cases is listed here as well as the number of people who have died from COVID-19. So we can see Quebec is really experiencing a massive inundation in a way that they weren't just a week ago. BC and Ontario were leading everybody in cases, but the number of confirmed cases in Quebec has really shot up. This site is the World Health Organization site. Let's see here, and they almost every day they have 3 or 4 health experts coming on to talk about the science of COVID-19, and particularly what's being done for bulk testing and what's being done for immunization development. And they also talk about epicenters around the world, and just really important information from a resource that you can trust is providing you with good medical science. As you can see, they're answering general questions, they're giving you situation reports, travel advice. Of course, we all know don't travel is the best advice. They're talking about research and development, and there's even a Mythbusters section here to allow you to actually make sure that you're not getting caught up in false information, but you are following best practices as based on science. I wanted also to share with you something. There was, I don't know, when this whole thing started, there was some talk about how perhaps the use of ibuprofen would make people with COVID-19 more sick rather than be helpful. This link here, which again is in your PDF, really the short version is that's not true. There's no evidence whatsoever to suggest that ibuprofen worsens COVID-19 symptoms. So acetaminophen and ibuprofen are both effective pain relief sources for you to use when you have COVID-19. I want you to make sure that you share that with people as much as you possibly can, as well as by all means share all these links. But that one particular piece of information could be really beneficial for somebody, especially because everybody bought the Tylenol. You're going to find no problem getting Advil, but it's pretty hard to get the acetaminophen right now because everybody kind of went nuts with this basic misinformation. And so all the Tylenol was purchased and lots of ibuprofen left. So not to worry if you've got Advil or other forms of ibuprofen handy and you were thinking, oh drat, I don't have any Tylenol. You don't need it. This will do the trick for you. I also wanted to share with you a Facebook page that I found helpful if you're on Facebook. It's called Coronavirus COVID-19 Scientific Discussion Space. We have some fun on this site. There's a few fun memes that get posted, but the data that gets presented has some good support behind it. So it is, I think, a private, or it says public. You do have to, maybe you just have to click to join. I can't remember, it's been a while now. But I highly recommend that if you're on Facebook, Coronavirus COVID-19 Scientific Discussion Space.
Thank you for watching CTOM TV. Subscribe below and stay informed.